This week's Ask Dr. Durie is a question that continues to come up from time to time, and that is about second primary malignancies, second cancers that can occur in patients with myeloma. And the specific question in this case is, does the 7% risk of developing a second primary malignancy, is it worth the risk? And so what this questioner is asking is, in the post-transplant setting, so for a patient like this patient who has had an autologous stem cell transplant and is being offered Revlimid as a maintenance after the transplant, meta-analysis has shown that over time, the cumulative, or so the buildup of possibilities over time, is that approximately 7% of patients might have a chance of developing a second primary cancer over time. And so the question is really, does the benefit of the maintenance balance with the risk of this 7% chance? And so this is really a very, very personal decision, and something that always needs to be talked about carefully in terms of pros and cons with a patient's personal doctor, because the risks are influenced by the individual details in each case. And so the risk is age dependent. The risk is a little bit higher for older patients. For some reason, it's a little bit more common for men. It's also a little bit more likely in patients who have high-risk disease, where the myeloma itself has abnormal chromosome findings. It's also influenced by the specific details of the treatment that has been used to achieve the remission. And so in one of the studies, the IFM trial, some of the medicines that were used to achieve the remission may have impacted the slightly higher risk in the French study, in addition to the use of the high-dose melphalan for the transplant. And so, yes, there is a risk. Yes, there are pros and cons. And I think that the best advice is to sit down carefully with your doctor and discuss what the risk means for you. I would emphasize one closing point, which can be really the bottom line for this particular question, and that is that it is always possible to treat relapse or reoccurring disease when it happens. And so the worst case scenario, if you decide that you are uncomfortable with the risk, if you think, well, you know, I just really I'm kind of afraid about this chance of a second cancer, you can monitor closely, and if the myeloma is showing signs of reactivating, then the myeloma can be treated very, very well at that point of early relapse. And so it is truly a balanced decision. And for some patients, the idea of allowing that opportunity for early relapse is a little bit scary, and that is understandable. And in a lower risk situation, the Revlimid maintenance therapy may be a really good ongoing choice. And so discuss carefully and make your decision based upon what feels most comfortable to you once you know all of these facts.